Hey there, health enthusiasts. Thanks for subscribing to TrendTap. Today I'm diving into Addison's disease, a rare but significant endocrine disorder that affects hormone production in the adrenal glands. This condition is named after Thomas Addison, who first described it in the mid-19th century. So, what exactly is Addison's disease? Addison's disease, also known as primary adrenal insufficiency, happens when your adrenal glands don't produce enough cortisol and aldosterone. These hormones are crucial for regulating metabolism, blood pressure, and stress response. It's a rare condition, affecting about 9 to 14 people per 100,000, and is most commonly seen in middle-aged women. Now let's talk symptoms. Addison's disease often sneaks up gradually. You might start noticing abdominal pain, gastrointestinal issues, weakness, and weight loss. One telltale sign is hyperpigmentation. Your skin might start to look darker, especially in the creases of your hands and around scars. Mood changes are also common, which can make this condition tricky to diagnose. But here's the critical bit: adrenal crisis. This is a medical emergency characterized by low blood pressure, severe vomiting, and even loss of consciousness. If you or someone you know experiences these symptoms, seek immediate medical attention. So, what causes Addison's disease? Most cases are autoimmune, meaning the body's immune system mistakenly attacks the adrenal glands. Genetics play a role, and certain infections like tuberculosis can trigger it. Other potential causes include medications, sepsis, and physical damage to the adrenal glands. For diagnosis, doctors typically use a combination of blood tests, urine tests, and medical imaging to confirm Addison's disease. Once diagnosed, treatment usually involves hormone replacement therapy. Medications like hydrocortisone and fludrocortisone are commonly prescribed to replace the deficient hormones. Stress management is crucial, and carrying injectable corticosteroids can be a lifesaver during an adrenal crisis. In conclusion, early diagnosis and treatment are key to managing Addison's disease effectively. If you suspect you or someone you know might have symptoms of Addison's disease, don't hesitate to seek medical advice. Thanks for watching and stay healthy.